Hello, my name is Jesus Casares. Today I will be talking about telemedicine, telehealth, and virtual care. I want to talk about how they are similar and different from each other, and how they have impacted society and even healthcare facilities. Let me explain what telemedicine, telehealth, and virtual care are. Telemedicine refers to the use of information technologies and electronic communications to provide remote clinical services to patients. In other words, telemedicine is basically having a virtual meeting with your doctor without going to the clinic or hospital. Unlike telehealth and virtual care, telemedicine specifically refers to the education over distance and healthcare services throughout the use of online tools. Usually, remote treatment by primary care providers or specialists, digital transmissions of medical imaging, remote medical diagnosis, and evaluations, and even video consultations with specialists are all the examples of telemedicine. Telehealth is a broad term that includes all health services provided using telecommunications technology, while telemedicine refers specifically to clinical services. In fact, telehealth and telemedicine are generally covered within the broader scope of term telehealth, thus making telemedicine be a part of what telehealth involves. Telehealth covers a broader scope in which it involves health education services, a remote monitoring vital signs, EKG monitoring, and even doctor-patient consultations. Virtual care encompasses everything healthcare-related interactions done online, from being in a meeting with your doctor online to giving you a healthcare education and services, and even checking in after an in-person visit. The term virtual care talks about the way patients and doctors can use online tools to communicate in real time. While telemedicine refers to the patient care, virtual care is a much broader term that refers to a variety of digital healthcare services. This may include checking in after an in-person visit, monitoring vital signs after surgery, or having a discussion about the diagnosis and the recovery plan. Both telemedicine and telehealth fall under virtual care, thus having virtual care envelop everything, making it all have the pros and the cons of each one. Virtual care has helped in giving more attention to treating a patient correctly and not rushing to get them out, so it doesn't get too crowded and it doesn't get out of control, and fewer supplies are being used, even making all the healthcare workers less stressed. It boosts morality within the workspace so that way everyone can be happy. If a treatment plan can't fit into a patient's lifestyle, it could end up becoming partially completed or abandoned totally. Since telehealth and technology is typically easy to travel with, patients can travel while still connected to the health networks. That constant line of communication helps to keep patients accountable for their own health. Additionally, secure cloud folders and storage let doctors and patients share information from anywhere, so patients can quickly receive advice from their physicians even when on the road. It also has the power not only to break down typical geographical barriers to care access, while also making the entire healthcare delivery model more convenient to patients. This helps improve adherence, ultimately leads to better patient outcomes. Remote analysis and monitoring services and electronic data storage significantly reduces healthcare services costs, saving money for you, your patients, and insurance companies. A built-in billing system also makes patients' payment collections for virtual appointments simple, with no money or time spent on sending out paper bills. This also reduces the unnecessary non-urgent ER visits and eliminates transportation expenses for regular checkups. It It also help it's also helping shape the next generation of health science, and new ways that will be made to help both the providers and patients by involving less time waiting and more time focused on what's important. This, however, does not compete with the repercussions. Sometimes internet access won't be available and patient might not be able to log in. Or the patient may not have the best quality of camera, this resulting in the doctor not having the best diagnostics on the patient. The hospital will also need to get good internet connection that can run all the meetings of all the doctors in the hospital. Lagging or connection interruption will probably be common within a good route with a good router. While there may be a patient base that is not computer literate or may worry about equipment costs and setups, then money-wise it will cost to keep it up day and night. Physicians may not feel comfortable conducting an examination over video chat. They might need to look at the body closely with their own eyes and their equipment that is up to date. Sometimes the patient doesn't truly understand what the physician is asking, and it could result in a wrong diagnostic. With this, I wish to speak about how all three have been impacted by COVID-19. It's helped with keeping order in hospitals and clinics and not making big crowds, and even helped with lowering the risk of patients and doctors catching COVID. And as said previously, it keeps all the healthcare workers focused on the patient who truly needs to be taken care of, and it's less stressed on everyone involved, just resulting in workers being more compassionate and giving a patient a nice smile. It can also make it so if someone is sick, they can rest in the home, not risking others' infection. Telemedicine and telehealth and virtual care have come a long way, giving everyone access to education and diagnostics appointments within doctors and check-ins after surgery or treatment. While they have some repercussions, I feel like they have influenced healthcare in general. In the future, more facilities will start to implement and doing into policies. The way we know health science may end up changing in the near future. It could lead to more job openings and future degree plans. It can also bring into internships so other companies can get involved. It could provide partnerships with others, and it could lead to a bigger interest and more money saving on every part. It will also lead into a better future so we can all be taken care of simple and not worry too much about our health. Thank you. This is TED Talk.